Our next presentation will be Impact of Early Amputation on Outcomes and Hospital Length of Stay and Burn Injury by Dr. Shelby Harris out of Orlando.
All right, good morning, everyone. I'm Shelby Harris, and I'm a fourth-year resident at Advent Health Orlando. We have a partnership with Orlando Health and get to rotate and do our burn rotation, our trauma rotations over at Orlando Health. So I'll be presenting on my time over at the Warden Burn Center. And just want to thank you again for allowing me to speak. Here's our disclosures from our team. And then some objectives for my talk is to present a representative case illustrating how early amputation can influence survival, complications, and recovery. We also reviewed our institutional data on burn-related amputations and, again, the impact of delayed versus early amputation on outcomes. And again, want to just highlight some clinical implications for providers and hopefully a take-home message for you guys to take back to your programs. So some background. Amputations are, although rare in the burn community, is still very challenging and present significant comorbidity or morbidity for the cases, and the reported amputation rates are 1.2 to 1.4% in adult burn patients. They do have a higher association with higher percent TBSA, as well as full thickness injuries, and of course electrical mechanisms. So infections, patient family resistance, and provider delays all incorporate possibilities for why they prolong time to amputation. A lot of our experiences also with the patient and family resistance, so that is something that's very important to note. So again, I wanted to present our institutional review. We're a single center, ABA verified burn center, and so our patients that we included in this study were adult inpatients over 18 years of age, and the data obtained was from 2010 to 2020. And so with prolonged time to initial amputation, we had an association with positive tissue cultures, vasopressor usage, increased mortality, and prolonged hospital length of stay, all of which are very important factors for patient care, as well as dollar signs for the hospitals. There's a lot of important things to come from this. The statistically significant portions of this were positive tissue cultures and increased mortality. Again, back on our early presentation, I think it was the first presentation of the day, we talked about tissue cultures and amputations. Again, this is very prevalent. So the case I'm going to present is where a decision for early operative intervention did lead to a favorable outcome. So our patient is a 32-year-old male. He was sustained an MVC with prolonged extrication, about a 30% TBSA, thermal burn with inhalation injury, and a multi-system trauma. And so he initially underwent escharotomies to that right lower extremity, as well as within the first night of his hospitalization underwent an emergent guillotine below the knee amputation. And just for his completeness for the operative courses for him, he did have some stump necrosis that extended proximally to include the knee joint. So he did end up needing an AKA, and this was later formalized into formalization of the AKA through a revision, as well as multiple debridements with allograft replacement and eventual autografting. Here's a picture of his limb after the AKA and his initial debridements, followed by the autografting. So his hospital course, he did remain in very critical condition in the ICU for weeks. He did sustain cardiac arrest from his severe hyperkalemia and acidosis, underwent treatment with dialysis for his acute kidney failure, again, given the rhabdomyolysis and acute tubular necrosis. He did remain on vasopressors for a good couple weeks, and then he remained on the ventilator and underwent tracheostomy. So after his initial ICU stabilization, his recovery was guided by multidisciplinary care, including the burn surgery team, as well as our rehabilitation services, and he was ultimately discharged to inpatient rehab on hospital day 108. So later he had his 1-year follow-up. His wound is fully closed, and he does have some ambulation with a prosthetic limb. So again, I would like to highlight a good outcome for him. This is another picture towards the end of his hospitalization with some healing wounds. And then, of course, 1 year later with fully closed wounds and, again, able to ambulate with a prosthetic. So for discussion, as previously stated, burn related amputations are very complicated and have a increased length of stay. In this case, obviously highlights that. And again, the discussion is early decision making and limb salvage, and versus going for an amputation. And this definitely takes multidisciplinary coordination, therapy, and individualized care for these patients. And again, mentioning the stage surgical planning in conditions like this. Our conclusion for this case was that, and our institutional review was that delayed initial amputation correlates with poor outcomes, and early amputation, especially in a critically ill patient like our patient, can prevent further decline. And again, I think in this patient was life-saving. For early amputations, reducing complications and expedite recovery. And then again, I really want to stress that patient and family education is very vital in these conversations that you're having with the patients. Addressing fears, highlighting benefits of the surgery, really need to address that psychosocial factors for these patients and their families, because that's a really big resistance factor for these treatments. And again, individualized rehabilitation remains key to long-term outcomes.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.